In the United States alone, an estimated 3.7 million people are affected by trichomoniasis, a common sexually transmitted infection caused by a microscopic parasite called Trichomonas vaginalis. While also affecting both sexes, women face a vast majority. For MDC News, I am Eduardo Guzman, and today, Dr. Caitlin Gomez and specialist Dr. Emily Escobar provide us with a deeper look into the U.S. third most common sexually transmitted disease.
Thank you so much, Eduardo. Hello, everyone. We're so thankful to be here to share some important facts with you all. We are part of the Women in STEM program, a team of women researchers who work closely with clinics dedicated to studying sexually transmitted infections and focus on teaching individuals how to prevent sexually transmitted diseases.
Today, we're specifically going to talk about Trichomonas vaginalis, as Eduardo briefly mentioned, also known as trich, an STI that many people don't know much about, but it's more common than you might think.
We've been working closely with Dr. Britt to develop a new treatment, and we're excited to share our findings with you. Let's take a quick look at her interview with the Mayo Clinic.
I would first tell patients about Trichomonas vaginalis, the parasite that this test detects, since many people have not heard about this organism before. It is actually an underestimated pathogen that causes a large amount of disease worldwide. It is the most common curable sexually transmitted infection in the United States, and more than 3.7 million individuals are infected. Many people do not experience symptoms due to infection, but women may have mild to severe symptoms, including vaginal itching, burning, and discharge. Importantly, infection also increases their likelihood of acquiring other sexually transmitted infections, such as HIV, and may cause low birth weight and preterm delivery in pregnant women. Men can also experience symptoms such as urethral or penile pain and discharge, and burning with urination. After I told my patients about Trichomonas vaginalis, I would then tell them about how this new test detects the genetic material from the parasite and is much better at detecting infections than other methods on the market.
As our colleague Dr. Pritt mentioned, Trichomonas vaginalis is a protozoan parasite that causes a sexually transmitted infection. It's the most common yet curable non-viral STI globally.
This is true. The parasite is transmitted through sexual contact, and it can infect anyone who is sexually active. The World Health Organization reported that there were an estimated 156 new million cases amongst people aged 15 through 49 years old globally in 2020.
What is Trichomonas vaginalis? A. A virus that causes the flu. B. A bacterium that causes food poisoning. C. A protozoan parasite that causes a sexually transmitted infection. Or D. A fungus that causes athlete's foot. C. A protozoan parasite that causes a sexually transmitted infection. How common is Trichomonas vaginalis in the United States? A. Less than 100,000 cases annually. B. About 500,000 cases annually. C. Approximately 3.7 million people are infected at any given time. Or D. Over 10 million cases annually. C. Approximately 3.7 million people are infected at any given time.
Dr. Escobar, can you tell us a little bit about the history of this disease?
Yes, of course. Trich was first discovered in 1836 by Alfred Donné, a French physician and microbiologist. Alfred Donné was a pioneering scientist in the field of microbiology and medical microscopy. Donné identified the trich parasite while examining vaginal secretions under a microscope. The discovery of trich was significant at the time because it highlighted the role of protozoan parasites in human infections. This was during an era when the use of microscopes was becoming more prevalent in medical research, leading to many groundbreaking discoveries in microbiology. So, what do you think, Dr. Gomez?
Well, actually, Dr. Escobar, there was a limited understanding of how Trichomonas vaginalis was transmitted and its full impact on human health. Early misconceptions often led to the underestimation of its prevalence and significance. Over time, advancements in diagnostic testings, such as wet mounts, culture tests, antigen tests, and nucleic acid amplification tests, improved the ability to detect Trichomonas vaginalis accurately. Increased awareness and understanding of sexually transmitted infections have highlighted the importance of diagnosing and treating trichomoniasis to prevent complications and reduce the spread of other STIs, including HIV.
Thank you for touching on the topic of increasing awareness, Dr. Gomez. In this generation, we have seen an uprising of various sexual diseases, and it is important to understand how it spreads so we can prevent it effectively. When reading about this infection, I came across common symptoms of Trichomonas vaginalis. Some people may experience itching, burning, redness, and unusual discharge, while others might not have any symptoms at all.
Yep, that's correct, Eduardo. According to the World Health Organization, although 70% of those infected are asymptomatic, more than 50% of women with Trichomonas vaginalis have vaginal discharge, and about 10% of men have irritation of the urethra. This is why regular checkups are so important. The infection can be diagnosed with a swab sample from the genital area. Early diagnosis and treatment can prevent complications and the spread of infections to others. However, it is more important to be aware of how proper sexual habits can avoid such diseases from threatening human beings, which proves the importance of sexual education.
Sexual health care can include lots of different things, like access to birth control or emergency contraception, STD and HIV testing and treatment, accessing the HPV vaccine, a gynecological exam, or just regular checkups. Depending upon where you live, there may be many places to get sexual health care, or there may be very few. School may be a good starting place. Some schools have a school-based health center and may offer services on site. Another place you might go to is a local hospital, health department, or Planned Parenthood. In some states, minors can get sexual health care without a parent's consent. In others, depending on your age, you may need the consent of your parent to get services. Call to ask about confidentiality if that is important to you. You have the right to ask. Can I get services here without my parent's permission? Will my parent be told about my visit? Will my parent be allowed to see my records? How will you contact me if you need to? Will my parent see the bill if there is one? Sometimes it can feel a little scary, awkward, or embarrassing going to a clinic for the first time. Just take someone you trust along with you for support. Some healthcare centers, like a school-based health center or Planned Parenthood clinic, will be free or low cost. You may also find online tools like apps available to help track a period, help with reminders to take a pill, or find access to sexual health services in your community. And there are also hotlines with toll-free numbers available for specific information, like access to STD and HIV/AIDS testing through the CDC's 24-hour National AIDS Hotline at 1-800-CDC-INFO.
While working with Dr. Gomez, we've researched a treatment for Trichomonas vaginalis that has shown promising results in clinical trials. The treatment involves a combination of antibiotics that target the parasite more effectively and reduce the chances of reoccurrence. Prevention is also crucial. Using condoms during sex, having regular screenings, and communicating openly with your partner about sexual health can significantly reduce the risk of this infection.
We understand that there is often a stigma associated with STIs, including trichomoniasis, which can prevent people from seeking treatment and discussing their sexual health. Education and awareness is crucial to reducing this stigma and encouraging preventative measures and timely treatment.
Now, let's play a game called Myth versus Fact. We'll present some statements about Trichomonas vaginalis, and you have to decide whether each one is a myth or a fact. Ready? Let's get started. Statement number 1. Trichomonas vaginalis can only be transmitted through sexual contact. Is this a myth or a fact? This is actually a fact. While sexual contact is the primary mode of transmission, it is the most common and effective way the infection spreads. Statement 2. Both men and women can get infected with trich. Myth or fact? This is actually a fact. Both men and women can be infected with Trichomonas vaginalis, although women are more likely to show symptoms. Statement 3. Trichomonas vaginalis infections always show symptoms. Myth or fact?
This is a myth. Many people with trich do not have any symptoms, which is why regular screenings are important. Statement 4. You can get trich from toilet seats. Myth or fact? This is a myth. The parasite cannot survive long on surfaces like toilet seats, so transmission in this way is extremely unlikely.
Great job, everyone. Thanks for playing Myth versus Fact. We hope this game helped clear up some common misconceptions about Trichomonas vaginalis.
As a reminder, there are ways in preventing trichomoniasis, such as choosing one long-term monogamous sex partner who has tested negative for STDs and or practicing safe sex using a condom correctly every time. While using a condom does not remove all risks, it does create a barrier during intercourse that helps block the transmission of trichomoniasis as well as other common STDs. Or simply, just don't have sex. Most importantly, make sure to talk openly about STDs before having sex with someone, as it can help you avoid getting infected.
Thank you, Dr. Escobar and Dr. Gomez, for sharing insight on this global issue and being able to inform viewers of various ages to reduce the amount of infected individuals. If you or someone you know has questions about trichomoniasis or any other STD, please reach out to a healthcare provider. Once again, this is Eduardo Guzman reporting to live for MDC News.